All right, after giving cover to the Chinese Communist Party and then sitting on their hands when COVID-19 was beginning to spread, the World Health Organization is looking to grab more power and authority for future international health emergencies. Now, remember, the Trump administration was wanting to defund them and move America, the U.S., out of participation with the World Health Organization because they were so bad. Well, now they are doing two things to fast track, or two different tracks they have going here. One is a global accord, whose decision-making body, the World Health Assembly, has been working on since December. And the other is through major rule changes. This is the fast track to the international health regulations. And the Biden administration is reportedly spearheading this. So here we go from one administration that recognizes the ineffectiveness of the World Health Organization to an organization now that's trying to give them more power that may even undermine national security or national sovereignty and with it impact your family. Joining me now to go into greater detail on these two concerning developments is Canadian lawyer Michael Alexander, who is co-chair of the Law and Activism Committee of the World Council for Health and is a constitutional litigator at the Calgary-based Justice Center for Constitutional Freedoms. Michael, welcome to Washington Watch.
Thank you, Tony. It's great to be here.
So I want to start with just kind of a really elementary here so our viewers and listeners will understand the powers or the authority that the World Health Organization currently has.
Yes. Well, something most people probably don't know about are the international health regulations. I mean, I just found out about them a few weeks ago. Those regulations are an international agreement that really has not been publicized, but it's been in place since 1969. It was modified in 2005. And now the Department of Health and Human Services is seeking amendments to the international health regulations that would drastically increase the powers of the executive of the World Health Organization and the Director General in particular. And this is all as a prelude to the WHO's proposal to create a new global treaty on public health, which will give even greater powers to the Director General at the expense of domestic sovereignty. So this is something that we have to alert the public to. And in the middle of May, coming up around May 22nd, the WHO will be meeting in an assembly to consider these international health regulations that have remarkably been proposed by the United States.
So Michael, what's happened in the last 2 years that has restored our confidence in the WHO?
Nothing. I mean, just to begin with, I mean, their funding model it guarantees conflict of interests. I mean, we all thought, many thought, at least I did before this pandemic, that the CDC, the FDA, the NIH, the WHO, they're independent, bureaucratic, neutral bodies, so to speak. But in fact, they're all funded by big pharma and private economic interests. In fact, Bill Gates and the Gavi Alliance, which he founded and continues to fund, contribute over $1 billion a year to the WHO's budget of $7 billion. So you think that doesn't translate into influence? You'll have to think again. So we're looking at, in terms of the WHO, a dramatically conflicted organization, which is serving its own interests as well as the interests of big pharma and Bill Gates. And so it's not thinking about the public interest, which is its goal, or which is its main purpose in any way, shape, or form.
Michael, anytime I hear the term global accord, I get a little concerned because the values that we see emanating from the United Nations, not that America is by any means perfect these days, but our values seem to be a lot different than the rest of the world. And this conflating of these values often find their way into these global accords. What do Americans, because Congress is not involved in this. This is something that's being done unilaterally by the administration working with WHO, if I'm not mistaken. Is that correct?
That's correct. In fact, the international health regulations, they're in effect a treaty, but they were never considered by the Senate. In the US, the executive, in effect the president, can ratify an international agreement and incorporate it into domestic law. And that's what happened with the IHR regulations to begin with. And now they're seeking to do this the same way. So they're trying to do it and then run around the House and the Senate.
So, Michael, give us some practical implications of this. How, let's say, and I've been saying this since the last, or since, I guess we're technically out of the pandemic according to the administration, but we may be back in it. But another one's coming. So how would this, in a very practical sense, how would this affect states here in the United States if these amendments are made to this agreement?
Well, first of all, you have to understand that the definition of a pandemic has been changed by the WHO, and this happened prior to the so-called coronavirus pandemic. And previously a pandemic was defined in terms of differences between mortality rates with the seasonal flu, which worldwide would mean about 250,000 deaths per year, and then an actual public health emergency, which was defined as magnitudes of mortality beyond the annual seasonal flu. So WHO did away with that. So it's no longer tied to mortality figures, which makes the thing very loosey-goosey and subjective at their end. Now, what's happened with the international health regulations is the US is proposing that the Director General have the right to unilaterally, in conjunction with his internal staff, but of course that means nothing, to unilaterally declare a public health emergency in a member state without that state's consent. Now, under the old regulations, or the regulations as they exist at the moment, if a member state disagrees with what the Director General says in terms of you have an epidemic within your borders, you can say, we don't agree with you, and the matter comes to an end. But under these new regulations, the matter will not come to an end because the Director General can tell the entire world, all member states and intergovernmental organizations, and I assume the press, that, for instance, the United States is ignoring the WHO's public health warnings. And so you'll see a tremendous international pressure being enforced against a country that disagrees with what it says.
Now, Michael, I know you've had your challenges there in Canada in this pandemic. But here in the United States, we've had our challenge as well. In fact, all of Western civilization has seen this pandemic, quote unquote, pandemic being used to limit certain freedoms and, freedom of speech, freedom of religion.
Absolutely. So
we had, in this country, in our federalist system, we have states that have the ability to fight back to the federal government. So you're saying that under these new modifications, that if the World Health Organization says you've got a pandemic in the United States, that they would be able to force a federal administration to take action, eclipsing not only the federal government, but the state government to operate. Is that correct?
Well, they wouldn't be able to force, but they'd be able to use any means of coercion that they could against a country who disagrees with their estimate or their assessment of the situation. But this is just the prelude to what they're really working toward, which is a new WHO treaty, which is different than the international health regulations. And they want to sign a worldwide treaty that would transfer a power from domestic governments to the WHO, such that the WHO could declare, for instance, that the United States has a pandemic, and the United States would have to put up with that and then take the measures domestically that are required by the WHO. So the treaty is really the bomb that they are trying to drop on the world.
Now, would that have to be ratified through our Senate?
It would have to be ratified by the Senate. So actually, it's approved by the Senate by a 2/3 majority,
right,
if it can be, and then it goes to the president for ratification.
But they're trying to do this through the regulations, just through influence of giving this, this authority to the WHO to declare this pandemic without the enforcement mechanism.
This is the first stage in the power transfer.
Yeah.
That's what the international health regulations are about. And so they set the stage for the second transfer that they are seeking through this treaty campaign, which got underway in November of 2021.
So to borrow from the great philosopher Barney Fife, this needs to be nipped in the bud right now.
Yes.
What do people need to be doing?
Well, at the World Council for Health, we have declarations, we have open letters to the WHO that inform people about what's going on, and people can download these letters and circulate them to friends, send them to their government representatives, send them directly to the White House, and take your stand against this. Now is the time to be lobbying your representatives to be aware of what's going on, because many people in government are not aware of what's going on. Most of this is going on behind the scenes. There is no transparency here at all. So the transparency has to come from the outside. And so people have to get active. They have to take the initiative if they want government to pass on these terrible proposals.
And folks, I've got a link to Michael's site at tonyperkins.com. You can follow links over and download the documents that he mentioned, the letters. But look, you have an opportunity to talk to your members of Congress. This is, sometimes, Michael, what we find in our country is that if you simply shine a little light on it and let the administration know, we know what you're doing, it makes it more difficult for them to do. We just saw this recently in some rules they were trying to pass on the whole transgender issue. We were able to get them to back off because people were watching. Now, this meeting is taking place of the WHO in Geneva beginning on the 22nd of May. Is that correct?
That's correct.
All right, so correct. This is where they will entertain these amendments?
Yes, so the World Health Assembly will vote on these amendments. And so the delegates who are sent to the assembly don't have the power to bind the governments they represent. But what they will do is establish the basic terms of the agreement. And then it will be up to, for instance, Canada or the United States to agree to incorporate those amendments into the existing international health regulations or not. So it still depends upon a government decision. So this is why it's also very important for people to reach out to their governments now to object to this wave of reform that's coming from the WHO.
But as you said, a lot of this is actually being pushed by the Biden administration here for these changes to be made. Is that correct?
Absolutely. An assistant for the deputy secretary for DHS, Lois Pace, is the person who's pushing this. So you can look her up on the internet, reach out to her and tell her that you disagree and you don't want her delegation to present this in this form to the WHO.
Yeah. Well, and time is short, so we need to do that right away. Michael Alexander, thank you for joining us today. Appreciate your work on this and sounding the alarm.
Thank you, Tony. My pleasure to be here.